Hi, my name is Mary Delansky, and I'm an Associate Professor of Nursing at the Francis Payne Bolton School of Nursing here at Case Western Reserve University. And I'm delighted to be with you, although virtually, and I apologize for not being able to be there in person. I am excited to share with you a brief discussion about faculty development and new ways of learning in interprofessional education. And I know you're engaging in an interprofessional education activity today that's including this interprofessional component. And there is evidence and trends in healthcare that are pointing to the need for us to work in these interprofessional teams. And therefore, we need to educate our interprofessional faculty to be able to role model these skills for our learners. So you may be thinking at this point, why do you need to work in an interprofessional team? Well, current trends are really moving toward team care. If we think about pediatric care, geriatric care, these disciplines have been working in teams for many, many years, but now we're moving toward primary care, the patient-centered medical home model, and other examples of where it's imperative that we work in teams. Chronic disease management, the trend, is another reason why teams are so necessary, because one discipline cannot meet the needs of a patient in chronic disease management. And the economics of our healthcare system are requiring cost reductions that also leads to teamwork. And a big one that I'm interested in is safety. And we know that the medical errors are the third leading cause of death. And the Joint Commission has published year after year that most errors occur because of poor communication between disciplines. So this is a very important consideration of why you're here today. And I also really believe that quality is assured when we work in teams, and that's because we all have expertise that we can provide to our patients. And the collective, summary of this expertise really is what leads to good patient care. So briefly, I would like to just share with you my two simple skills for working in teams. And the first simple skill is interprofessional collaboration. And the three components of really having the skill of good interprofessional collaboration are these. First, to always share your views. You have an expertise, and it's important for you to speak up on what your expertise is. Second skill is to hear the views of others, and that is really listen and respect each other in order to get all the collective sort of intelligence from the team to make good care decisions. And then the third component of interprofessional collaboration is being willing to change your mind. So after listening to everyone's views and sharing your own views, really then thinking together to determine what is the best next step. And the second important tool that I teach for interprofessional collaboration those are the 4 principles of teamwork. And usually when teams are struggling or not, it's not going so well, it's usually can be circled back to one of these missing links. And the components of a good team include, first, clear goals. So everyone has to be on the same page of what the goal is. Each discipline can't have their own goal. It has to be one common goal. The second component are clear roles, that each discipline has to understand what is their component in this endeavor. And the next is clear expectations. So what is expected of each member, and that each member is clear on what the expectations are for them. And then the last component is the ability to give and receive feedback. So the team, every member of the team must feel safe in being willing and able to give that feedback and receive that feedback and learn from the feedback. I think most importantly, though, we must take into consideration respect. And that is respect for the expertise of all. And this can be sort of, rendered in a very easy way, and that is even just simply by calling professionals by their specific name instead of calling them allied health professionals or physician extenders. So calling nurse practitioners and physical therapists, physician's assistants. This sort of very simple way of showing respect goes a long way in interprofessional education, in interprofessional collaboration. So just as an extra piece for all of you today, at the end of this workshop, you will be given an opportunity to do some reflection and an evaluation of how the interprofessional collaboration went in your team today. This evaluation provides some time for you to think about, did you hear the views of others? And did you share your views? And were you willing to negotiate? So we just want you to reflect at the end on those three questions. The other opportunity will be that you will have some time to provide some feedback to other members on your team, such as, hey, you were kind of quiet today. I didn't really get, your views clearly. And maybe you could speak up more next time. Or, you really dominated our group and it really impaired our ability to hear the views of other people. So at the end, you'll have that opportunity to do some evaluation, which really will be some key to your learning of interprofessional skills. So again, I hope you enjoy this opportunity today to learn and to share learning content and also learning some interprofessional collaborative skills. And I really believe that if we do get expertise in this area, we will be able to enhance the delivery of healthcare to our patients and our families. So thank you for your attention on this important content, and I wish you well today. Thank you.